eHealth, innovative diagnostic and therapeutical solution for female pelvic floor and stress incontinence. I'm Fabrizio Gervasoni. I am a PMR physician. I work in a big university hospital in Milan, Luigi Sacco. Today I will talk to you about urinary incontinence. The involuntary loss of urine is a very common problem affecting up to 200 million people in the world. 1 in 3 women will suffer from urinary incontinence at some point in their lives, many after the birth of a child. Disposable products can manage the problem but offer no solution. In 80 to 90% of cases, treatment can cure or improve the condition. Today, I'll show you an overview result of pilot studies performed on 115 women aged 25 to 70 years old suffering from urinary stress incontinence. During these pilot studies, we used I.A.C.E.R, an innovative, non-invasive e-health solution composed of the I.A.C.E.R sensor and the I.A.C.E.R pelvic floor trainer application. I.A.C.E.R's Bluetooth sensor snaps inside a protective underwear, measuring the leakage and collecting data throughout the day. The measuring device is attached to the underwear at the introital position for females. The sensor is connected to an app via Bluetooth technology. The app has two functions. One, recording urine loss and calculating leakage reduction in the following weeks. Two, showing pelvic floor exercises on mobile devices. These systems require no intravaginal or intrarectal probes. I.A.C.E.R is an app and home-based stepwise programs that promotes daily practice and of pelvic floor exercise. The app gives access to a multi-week exercise program especially designed to help strengthen pelvic floor muscles. Exercising 10 minutes per day is useful to reduce urine leaks. These are inclusion criteria of our pilot studies. Women aged between 25 and 70 years, with mild to moderate pure or predominant stress urinary incontinence, capable of using handphone app, reading and filling in forms independently. These were the exclusion criteria of our pilot studies. The patient has to schedule one measuring day per week. On this day, the patient needs to wear the underwear with the sensor snapped in for 24 hours. The sensor will track movements of the body and gather data on the moisture that collects. These measurements will be recorded by the app on tablet or smartphone through the Bluetooth connection. During the following weeks, the app will calculate the progress. This calculation will show the impact of exercises by measuring the reduction of leak. When the sensor is connected to the app via Bluetooth, accurate documentations of amount and number of leakages is recorded, as well as the activities associated with the leakages. The I.A.C.E.R app provides a series of short exercise videos organized by week and especially designed to help strengthen the pelvic floor muscles. The app also offers notification to remind the patient to exercise 10 minutes per day. On day 1 of the measurements, initially low patient's activities trigger urine loss. Therefore, the app recommends training for the type 1 fiber. After day 3 of measurements, During this period, a high patient's activity triggers urine loss. Based on this, the training adapts and recommends exercises strengthening the type 2 fast fibers. On week 5 after day 5 of measurements, by this point the app is detecting fewer leakages, but they are a combination of type 1 and type 2 fibers. Therefore, the application recommends a combination of exercises for both type 1 and 2 fibers. Alongside, the application recommends these patients to drink less coffee and carbonated drinks to achieve a possible decrease in urine loss. By doing 10 minutes of exercise per day, patients recovered from their urinary stress incontinence condition. We measured recovery already within the first 3 to 6 weeks with the majority of the patients. The recovery is age-dependent. Patients aged between 25 and 50 recover faster than older age patients. Overall, 72% of women were cured using cutting, and 28% of women saw over a 50% improvement in their condition. For 65% of participants, we monitored the exercise frequency, and 72% of the women exercised daily, whilst 28% of the women exercised every 4 days. Overall, high correlation were found between the frequency of exercise and the desired positive result. The current solution is an efficient e-health solution to help health practitioners evaluate specific stress urinary incontinence symptoms during trigger activities. However, when using this solution, it is essential for practitioners to monitor the activity data and data follow the personalized training program within the app or suggest a personalized training program for the patient.